Hi, everybody. Dr. Kogan, Medical Director, George Washington Center for Integrative Medicine. Today, I want to talk about a brand new study that just came out a couple of days ago on effects of mistletoe on cancer. I'm going to go and share my screen. And the first one, I'm going to show you just where the study comes in and what the title of it. So this is the phase 1 trial of intravenous mistletoe extract in advanced cancer. The study is going to be published in the American Association for Cancer Research journals. This is proofs. So what this means is that the study has not yet been finally published. So I'm going to show you the proofs. This is the actual proofs. You can find this on PDF if you go to this link that will be posted in the description of the YouTube video. You will see this link to the website I just showed, and you can download the PDF file if you wish to do so. Again, remember, this is proof, so their final published article may change to some degree, although I don't really expect it to change significantly enough to alter any specific outcomes. Why is this study so valuable, so important? So for many years, we've been using intravenous mistletoe extract in our clinic, and many other clinics locally and nationally and internationally have been using. Very large percent of patients in Europe, particularly in Germany, use this approach for many, many decades. I would say that I wouldn't call it a standard of care for advanced cancer, but definitely it is one tool that in Europe has been used a lot more commonly than in the United States. The importance of this trial, that this is a first control trial done in the United States of America. This is done with our colleague, Dr. Channing Paller, who's an oncologist at Johns Hopkins. And this is the study that was sponsored by Believe Big, which is the nonprofit headed by Evelyn Page, who's also in this study, to support and promote the use of mistletoe for a variety of different cancers. So let's jump right in. So this was a relatively small study. As you can see from abstract, they've recruited only 21 patients, and those patients were pretty sick patients. You'll see in a second a complexity of them. They had to have a metastatic disease, and they had to fail at least one, and many of them failed up to 6 treatments, standard treatments, prior to the enrolling into the study. The mistletoe was started at 150 milligrams and then was titrated up to 600 milligrams. This was their average maximum tolerable dose, and they have stopped at 600. This is a little different from how we do. We start and titrate mistletoe a lot slower. And I think they probably did it faster because simply when you're running clinical trial, doing more things makes more cost and also more challenging. So I think that they try to speed up the protocol of titration up to get to the higher doses, because we do know that the higher doses are needed to achieve the effect. So please note that patients had a pretty significant amount of quote unquote side effects. Those are actually not as side effects. So those are direct immunologic effects that we're looking for. So 62% of patients had those quote unquote adverse events, which we consider therapeutic effects. So we want the patients to feel those reactions because we know that that's when the immune system gets upregulated. Patients can have fatigue, they can have flu-like symptoms, even with sometimes a little bit of nausea. They last for anywhere from a couple hours to a day or two, and they're very transient, and they're really not considered to be serious by any means. And we titrate the dose until patients experience those symptoms, and then if needed, you back down just a little bit. So most patients had, as expected, the symptoms. And what's really critical here to understand, so these are the patients that typically have some weeks to live, maybe a couple of months. And as you can see, and I'll show you some of the additional data in a little bit, as you can see that actually very few patients had severe reactions, so only 15%. And 24% of patients had either a partial or complete response. These are the patients that no one expected to have any meaningful survival beyond a couple of weeks. So this is a very significant positive event or positive study, because 24% of patients lived for a lot longer than expected. Let me show you a bit more data on who those patients were, because it's very important to understand as to which patients were included into the trial. Without that, it's very difficult to come up with a good understanding of the result. So, all right, so patients were recruited just at Hopkins. They had to have, as I said, stage 4 cancer in essence. Most of them were able to walk and they were able to make it to the clinic, so they were not in an imminent demise. So like, for example, ACOG stage 4 probably would mean that patients have a couple of days to live. So those were excluded. They were not included. The importance also was that all of these patients had to fail some other treatments previously. So they had to, but they had to also not have brain metastasis. This is important. Okay, so they just used one type of mistletoe, which is called Helixer M. Yes, that's the same product we use in our clinic. We use several different, and as you can see that if the dose and frequency and starting at the maximum dose level were informed by phase 1 trial of IV Helixer P. So they decided to administer this one based on some previous data. And so, and let me show you the actual result in terms of one particular data graph that I think is very useful. The organization of the article is a little different because this is not yet fully published article. Once the article is published, you will see a lot better figures, and things that generally look a lot better. So you can see that a variety of different cancers were treated. What you see here is whether cancer gotten larger or smaller. Most patients, as you would expect, of course, progressed, but some progressed very little. So this is the line of 20 diameter of the lesions that was increasing by 20%, and so here some of the lesions that gotten smaller. And I think the probably most important graph to understand is this one. So these are all of the patients, and what you see here, this is the point of death. So you've had several patients who lived for more than 2 years. So this is one patient who lived for more than 2 years, and several patients who lived for more than 12 weeks. So this 12 months. So this is not very expected at all. So 1, 2, 3, 4 patients lived for more than a year with a life expectancy of just a few weeks. What you can also see here is that most patients were not able to get to 900 milligrams. There was only 1, 2 patients, and unfortunately, those patients had very few doses, and they had to discontinue. The discontinuation of treatment was not necessarily based on side effects. It was practical. If the patients were progressively getting sicker and they were expected to pass, then eventually the therapy would be finished before reaching a 15-week target zone. And you can see that the 5 months treatment was only achieved in just 2 patients. But what's interesting, and those are the patients that's still alive, by the way. So what's very interesting here is that you see that even though therapy for some patients was discontinued pretty quickly, the effect lasted for quite a long time. So with that, I'm going to quickly summarize. So what does all this mean? Well, it's a pretty dramatic response. It's a very strongly positive study. It definitely vindicates against some of the critique against mistletoe. I think mistletoe is rapidly going to, starting with this trial, probably going to be more trials, will achieve more recognition in the United States for us as a standard part of oncological treatment. I do think that the phase 2 trial will be coming up very soon after this one. I'm pretty sure that Dr. Channing Peller or her colleagues or other people will start applying for larger NIH trials to actually have a randomized control trial. So again, this is a phase 1. This was not controlled, but nonetheless, it's very important data. Well, thank you very much. If you are interested in this treatment, or you have a friend or a relative or loved one who is suffering from cancer and would like to explore it, by all means, feel free to give us a call. In district, we're probably the oldest clinic administering this approach. We've been doing this for over 5 years now, and for hundreds of patients, and we can have you come to the clinic. Thank you very much. Have a good day.